Hi, my name is Dr. Mina Nashed, and I'm a dentist in the DC, Virginia area. I graduated in 2021 from the University of Florida. Pretty fantastic. It was heavy, but at the same time, very valuable. I learned not to just place implants, but think critically about how to do so properly. How to take care of complications, how to avoid them, how to think critically in terms of also just in a teaching environment. I think that was probably the most important thing. I can follow directions, but to be able to think on my own and be able to do it on my own, I think that was the biggest benefit that I got out of this course.
Were you satisfied with the number of surgeries?
I am very satisfied with the selections that I got. I got a few immediates. I got a couple of ridges that were just ready to place. I got a couple of grafts, which I felt was, a weak part in my surgical skills to begin with. So, to be able to raise the flap and then also to graft afterwards and place the membrane, that was hugely critical.
How did the mentorship from Dr. Ibrahim and Dr. Atari influence your learning?
Fantastic. The learning process, it was all about thinking critically, thinking about why we're doing what we're doing so that it's just not blind teaching. I think that was the most important thing for me, to be able to listen to their feedback and then they explain thoroughly why we're doing what we're doing so that it makes sense. I think the logistics from A to Z were perfect, from transport to lodging to food. I think we also had a fantastic time outside of the clinic as well, which I think made it fantastic. Got close to the other peers of mine and also to Dr. Atari and Dr. Ibrahim. So, I think that was what also made the class just a ton of fun to be able to just, relax, learn, but also be in a great environment as well outside of the clinic. I feel very comfortable with specific cases that I can walk into, very comfortable with, some immediates and then also with, regular ridges that are just ready for placement, wide enough ridges. I feel comfortable with looking at a CBCT and knowing what to look for, so that, I can understand if this is a case for me or if this is a little bit too complicated, or if we're going to need a lift or we're going to need a split, or, what other complications might arise. So definitely feeling a lot more confident to take on some cases, when I get back to the office tomorrow. I've been following you guys for a couple of years now on Instagram, so really happy I got to do it. And for those who are in that position, ready to start placing, get it done. I don't think that this is something to delay. The fears that I had all got quenched afterwards, so I'm pretty satisfied.
Nice.
Awesome. Thanks, man.
Thank you so much for your time.
Of course. Thank you.